Yo, what up? It's a tip of the week, and today we're going to discuss complications with extractions.
If you love this tip and want to go deeper, check out this course. I can describe this course in one simple phrase: surgical coaching in your office. Concierge Surgical Coaching is a PACE accredited with the Academy of General Dentistry. This course offers an innovative approach to surgical and implant dentistry that can help you achieve your goals. Concierge Surgical Coaching gives you affordable prices, hands-on training, how to handle complications, step-by-step methods for best results, and how to discuss patient finances and your return on investment. Gain the skills you can use now on your patients for tomorrow that could achieve your production, clinical goals while never booking a flight for education again. Start earning CE today. Enroll at jaredwdds.com.
All right, guys, so there's different types of complications. We're just going to cover the basic ones. In this video, we're going to specifically talk about complications during extraction. All right, so number one complication that I will see during an extraction is possibly bleeding. Now, when I'm talking about bleeding, it could either be from the actual root of the tooth, or you hit a nutrient vessel in the bone while you were sectioning or in the tooth, and that could be a bear. Now, how to address that? One thing that you want to do is figure out what position you're going to put the patient in. I generally have the patient looking up at me while I'm sitting down working on them. I would not be doing dentistry if I couldn't sit down, so that's exactly why I placed them in that position. And I'm generally sitting at a 12-degree angle, so I'm looking down as I'm working on them. So in the event that there's a bleed, I will have the patient bite down on some gauze. About the easiest and quickest thing that you could do. Sometimes it could take 5-10 minutes for everything to settle down. Specifically, I know there's different things like bone wax and different things along those lines, but I just like to keep it simple. I get some gauze, wad of it, have them bite down, work on another site while I'm working. Now, you really want to know the anatomy of the area that you're working in, because if you hit a vessel, you got to know, should I just bite gauze, or should I go in the clamp? Should I get in the cautery? Should I, crap my pants? Like, you got to figure out the one. But generally, if you're taking out just teeth, you're probably going to hit a nutrient vessel, and generally you could just go ahead and have the patient bite down. In the event that the bleeding is just too much, like if you treat patients like myself and they're sitting in a prone position, all you got to do is raise them up. And that helps out with excessive bleeding quite effectively. So if they're bleeding, you see a little bit too much, just kind of filling them out, bite down, sit them up, and just reassure the patient. Other thing that is a complication during the extraction is just fear. Like, a lot of patients are going to be like scared out of their freaking minds because you are going to rip out one of their body parts that they have grown accustomed to. And so the main thing with that is this: if you can't sedate them, then you're going to have to figure out how to date them. And what I mean by that is this: you're going to have some verbal anesthesia, and that's going to be able to calm them. I know some of my assistants that I work with, they're always saying, "Dr. Williams, you're always speaking very low." And the reason why I speak so low is because I don't want to freaking scare a patient. I already look like I'm 12 years old that I get from my patients. I don't want to add one more thing to them and their anxiety. So if you can't sedate them, you're going to have to date them by using verbal anesthesia and just making the situation go well. The other complication that you're probably going to end up falling into is a root tip. Now, everybody's so scared of these freaking root tips, and it's really something not to be scared of. Generally, in the book that I researched, I want to say it's Oral Surgery, Contemporary Oral and Maxillofacial Surgery, I believe it's edition 4 or 5. They basically say that if you have a root that's longer than 4 millimeters, you got to go get it. So if you broke it off in there, be wise. If you think that you've been taking out a tooth for at least 30 minutes to an hour, 2 hours, stop. Because all that's going to do is cause trauma to you and the patient and your assistant, and especially all the patients who are going to be waiting for you. So if you fall in that category where you're just taking longer than 45 minutes to an hour to get one tooth out, stop, refer them out, get them out. Or you could have somebody like myself, who's a concierge dental surgeon, could come to your office and treat them. specifically if you're in Houston at this juncture. But if you find yourself just getting into these issues, refer it out, like let them go. But in the event that you can, you definitely want to get a root tip if it's longer than 4 millimeters. Now, don't get in the habit of be like, oh, it's 3.5, I'm just gonna break it off. Don't be that person. Don't do it. If you don't think that you can get the tooth out, leave it alone. Let the patient make it, send it, refer it out, or have somebody come in your office, like a concierge dental surgeon that could take care of you. And there you have it, guys. Like, what I want you to do now is this: comment and post, like and subscribe, and give me some comments down below. Let me know if this information is impactful for you, because when I post this information, my focus is for you. Yeah, you to smile after surgery. So once again, I'm Dr. Jared Williams. Make it a great one.